All right, we are live. Just gonna wait a couple minutes, couple seconds. All right, let's get started. So I am Susie Johnson from the National Capital Poison Center, and we are really excited to be here with the Maryland Poison Center to talk about some common myths and misconceptions that people often have about poison control. So we have a couple of poison specialists here with us, and we've also got the educator from the Maryland Poison Center as well. So why don't you guys introduce yourselves?
Awesome. Well, my name is Emily Patterson, and I am the Public Education and Communications Specialist at the Maryland Poison Center.
My name is Elizabeth. I'm one of the nurses that answers the calls at the Poison Center.
Hey everybody, I'm Robert. I'm a pharmacist at National Capital Poison Center, and I answer the phones too. I'm a C-Spy and PharmD with National Capital in DC.
Awesome. Well, I am really excited that we were all able to get together today. And we have some really interesting topics to talk about. So just to start off, it's National Poison Prevention Week. And so we want to let people know more about poison control, what we do, when to call, all those kinds of things. So first of all, I want to talk a little bit about the differences and similarities between our poison centers. So the National Capital Poison Center and the Maryland Poison Center are neighbors, and we are two of the 55 poison centers in the country. So the National Capital Poison Center serves the DC area, so DC, Northern Virginia, and Prince George's and Montgomery counties in Maryland. We are a nonprofit, so we rely on individual donations and grants from federal and state governments, as well as private foundations for our funding. And we have a lot of different programs and public education resources. We have Web Poison Control, which is an online tool and app to get help online instead of calling. And we also have things like a quarterly newsletter called the Poison Post. We have social media pages. Our website is poison.org. And we also provide print materials like brochures and magnets and things like that. So we have a lot of programs and information available. If you check out our website, poison.org. And Emily will introduce the Maryland Poison Center so you can get to know them and some of the similarities and differences.
Thanks. So as Susie mentioned, the National Capital Poison Center does cover Prince George's and Montgomery counties in Maryland. And then at the Maryland Poison Center, we serve the rest of the state of Maryland. So the whole state except for PG and Montgomery. And the Maryland Poison Center is housed under the University of Maryland School of Pharmacy. And we are primarily supported through state higher education dollars, as well as federal grants and private contracts. And a little bit about our programming and public resources include our website, mdpoison.com, that's updated regularly with new information. And then for public education, we have a blog called E-Antidote, and we post about 2 new posts a month on our blog. We have our bi-monthly newsletter, Poison Prevention Press, as well as social media pages, a YouTube channel, and some print material orders that we have, including a poison safety packet for the home. So before we get into the myths and misconceptions of poison control, we wanted to give a little bit of background about what happens when you call poison control. So does one of our spies want to talk a little bit about what happens when someone calls the poison help number?
Sure, let's jump right in, right? Okay, so of course, when you call, it should be directed to your local poison center. We use a national 800 number. And so you will talk to a healthcare professional. A lot of people think that, I think at least when I first started in Poison Center, there was a misconception that a lot of folks on the phone were volunteers, but we're all trained professionals, whether you're a nurse, a pharmacist, physician, PA, NP. And on top of our professional licensure, we all have to sit for the certification exam yearly to maintain our skills. And so we're specially trained to respond to these types of poisonings, whether it's bites, stings, plants, medications, you name it. And when people call, we do ask for information because we have to have this to be able to make a good recommendation. Age, weight, what the product is, the percentage strength, milligram strength. Sometimes even having people read the imprint, the letters and numbers off of a tablet or a capsule, so we know exactly what we're working with, or what somebody may have ingested or taken a double dose of, whatever that may be. So product labels and kind of guiding people through reading product labels is really key here, because we need that information to provide a good recommendation. Or even as things as simple as, what did that plant look like, or what did that berry look like, or sometimes even what did that snake look like, or insect. So that information is absolutely key for us. And also timing, who we're speaking to, how to contact people back for follow-up calls, because we do always want to follow up on our cases. So phone numbers, emails, address, etc. And then if somebody has to go to the hospital, say if there was a double dose of medication, or say a blood pressure medication, or a child got into grandma and grandpa's diabetes medication, for example, these kind of cases that people have to go to the emergency room for, we'll follow up at the hospital, track their case there, provide recommendations directly to the physicians and nurses taking care of the patient at the bedside. But we do try to manage when we can at home, and about 75%, maybe 67, 75% can be managed at home with home follow-up from us, and the rest will have to go to the emergency room. So that's pretty much what happens whenever folks call.
Great, thank you. Elizabeth, do you have anything else to add?
Same thing happens when you call the Maryland Poison Center.
Yeah, so that's a good point to make too, because no matter which poison center you call, you're going to be connected to a poison specialist, someone who's specially trained, and they will ask you the same questions and give you the same recommendations. So yeah, no matter where you call in the country, you will get the same service. So let's start jumping into the myths. So the first myth that I feel like people think of a lot with poison control is that poison control is just for kids. Elizabeth, would you start us off in talking about why this is a myth and what the truth is?
Yeah, so the Poison Center is absolutely for anybody who thinks that they have a need for it. Adults make mistakes on medications. They take a double dose. They, get something in the eye, cleaning the kitchen, bleach goes in there. So it's for anybody, all ages. I mean, it's such a huge range. We do manage kids, and we do have training, again, in all the different ages and all the different situations that somebody might run into, again, regardless of age.
Awesome. And I want to point out some of the statistics of only about half of the calls that poison control receives nationally are about adults and teens. So while children under 6 definitely have the highest frequency of poison exposures, the exposures in teens and adults tend to be more serious. So that's something to know as well. And definitely, like you said, Elizabeth, I mean, poison control is for everyone of all ages. Yeah, anything else to add on that?
No, I think that sums it up perfectly.
Awesome.
Awesome. So our next one that we wanted to go over was the myth that poison control can only help people who speak English. Elizabeth, can you tell us a little bit about how we help callers who speak languages other than English?
Yeah, so all of the poison control centers have access to a language line that has any language that you might need available. And so it's just a matter of dialing into that service and getting them on call with the caller. And then again, we look to find what the information is. They get the same exact help as somebody who is English speaking would get. So there's not any difference in the management of the case. And again, we have access to several languages. So you should never let that concern stop you from calling the Poison Center.
Awesome. So yeah, they cover about 240 languages. So as long as someone can tell us the language that they need help with, we are able to connect with an interpreter within a few minutes.
Awesome. All right. The next myth that we want to talk about is that I can only call poison control if it's an emergency. Robert, can you talk about this one?
Yeah, sure. So that's absolutely a myth. So even last night when I was working overnight, we get calls all the time from the public, people that want help for identifying medications, for example. They've mixed up their medications or they put it in a pill minder. They can give us the imprint and we can identify, so we can do that. A lot of times people will call for dosing recommendations. So especially cough and cold and flu season and allergy season, how much children's Zyrtec should I give my 5-year-old? That is a super common question, and we're happy to help. All the nurses and pharmacists are eager to jump in and help out, because we'd much rather prevent than cure in a lot of ways. So if we can help people get that correct dosing the first time, that's fantastic, because it may save them a call to the poison center or a trip to the emergency room down the line. So there's no reason to say, it has to be emergency before I call. Not at all. And of course, if someone's not breathing, or they were found unconscious or unresponsive or seizing, these are calls to 911 first. And then 911 will contact the poison center or emergency services, EMTs come to the home, paramedics, ambulance crews. They'll call us directly for recommendations, and we're happy to provide those services to them on the way to the hospital or whatever the case may be. Or in situations where, rightly so, people get nervous because their child got into something, they call 911. Emergency services calls the poison center and says, hey, a 4-year-old got into some diaper rash cream. And we can say, hey, no problem. It's not something we have to take them to the emergency room. So we can that way as well, and try to avoid sending unnecessary trips to the emergency room if we can help it. But yeah, people call all the time for everything from, as mentioned, the pill identifications to medication dosing recommendations, even sometimes medication recommendations for, I've got heartburn, what can I take for that? And we're happy to help.
Great. Yeah, that's such a good point. I also like that you mentioned that if you call 911 first, then often the EMTs will call poison control for help managing it. And so there's really a partnership there with other health professionals as well. And Poison Center, you guys really are the experts in poisoning. So doctors and EMTs and anyone in an emergency room, they would call you guys. So I think that's really important for people to know as well, because I think a lot of people have a hard time knowing, when do I call 911? When do I call poison control? So hopefully this clears that up for anyone with that question.
Awesome. So the next myth that we wanted to talk about was the myth that the Poison Center will report me to the authorities if my child gets into something bad or gets hurt by a poison. Elizabeth, can you talk a little bit about that?
Yeah, so that's absolutely not true. Full disclosure, I've called the Poison Center for my own children who have gotten into things. So, there's a complete understanding that kids get into things, adults make mistakes. It's not our job to police or make decisions like that or judgments like that. I know myself personally and my coworkers, I would 1,000 times rather somebody call to be safe and to get good advice than to ever worry about being in trouble. Our goal is always to keep people safe. So, we try to keep people at home. If they need to go into the hospital, we make that referral. But again, it's all safety based on what the need is. It's not a reporting or a judgment thing at all. The other thing to mention is, sometimes I'll get callers and they'll mention, oh, I've called twice before or 3 times before. We don't know how many times you call. Each time you call, it's a separate phone call. The information is confidential. We are required to follow the same exact laws as a hospital or your doctor's office. So nobody can call us to ask us if you've called. We can't provide that information. We don't sell your information. So, I mean, we follow the same exact rules and regulations.
Yeah, I think it's super helpful to kind of give the same context that we follow, just like your doctor's office has to keep your information and your records private. We follow the same rules at the Poison Center.
Yeah. I almost feel like calling poison control as a parent is kind of a rite of passage. I know my mom called for me when I was a kid. You know, it's just part of childhood is getting into stuff. So it's great that poison control is there as a resource. And again, they don't judge.
So funny story, the week I interviewed at the Poison Center, the day before my job interview, one of my kids got into a medication and I had to call.
Oh, really? That's funny.
It was meant to be.
And I still got the job. So we definitely don't judge on it.
Even poison specialists need help from poison control.
Right.
So that's a great story. Okay. So the next myth that I want to talk about is about childproof. And a lot of people think that childproof packaging is, you know, all you need to do, that's going to protect your kids from poisonings, but we know that's not true. So would one of you like to talk about why that's not true and, you know, what are better ways to make sure that our kids don't get into poisons?
Sure, I can field this one. So actually, I bring this up when I teach a class on toxicology to EMTs and paramedics. I say that there's no such thing as childproof. Probably the closest you could get would be if you lock something in maybe a metal tackle box and you have the key to the lock or the combination, and then you took that box to the bank and put it in a safety deposit box at the bank. That would probably be childproof or shot into space. But that's about, I mean, not to sound silly, but we really want to say, especially as a pharmacist, child resistant is what it is. It's just really slowing them down in a sense. You know, kids are persistent. They have pressure and time on their hands. And, you know, adults get distracted, parents get distracted. Kids will get into it. You know, it's kind of, it's tactile. It's fun to mess with. I assume as a child. I remember my little sister got into them, something back in the day when she was itty bitty and my mom had to call. So, you know, like I said, that rite of passage, it happens. But what we really try to press is that, you know, make sure that everything stays in its original container. That can be as simple as cleaning products. You know, don't put your bleach or your detergent in a water bottle or drink bottle or in the fridge. A lot of cases of brightly colored cleaning products accidentally get put in the fridge next to the orange juice, and then someone takes a swig, or, you know, someone throws some detergent into a Gatorade bottle. I don't know why it's always a Gatorade bottle, but when they go into the laundromat, or in the winter, things like keeping windshield washer fluid in other containers and drink containers, and kids get into that. Absolutely keep medications and cleaning products and everything in its original container. And child-resistant packaging is just kind of one step because you may slow them down, but you also have to keep it locked up. So locked medicine cabinet, locked closets, locked cabinets, out of reach, out of sight. We always say, you know, don't call it candy because kids will happily mimic adults in this kind of situation. And kids are fast. I mean, so many calls, and I'm sure Maryland Poison Center folks would say the same thing, that, you know, parents will say, I would turn my back for 10 seconds and they got into it, and it happens. So.
Yeah. I saw that in order to be considered child resistant, to meet that like legal definition, 85% of children under 5 shouldn't be able to open it, but within 5 minutes. But that still means that 15% of children are able to open it in 5 minutes, and probably more if they had more time. So like you said, I mean, child resistant is just about slowing them down. And it's just one aspect of preventing poisonings. So thanks for talking about those tips.
All right. The next one is the myth of, if I swallow a poison, I should make myself throw up. So Elizabeth, can you tell us a little bit about why that's a myth?
Yeah, so actually we've had people call trying to induce vomiting. You can cause trauma. So, you know, sticking your finger down to try and vomit can cause, you know, more issues than what you got into. You know, sometimes people will Google and think, if I drink salt water that I can induce vomiting, and then that'll get all of what I took out. Everything that goes in has the potential to cause problems. So if you're drinking salt water to try and avoid what you think might be a poisoning, there's risks associated with that. There's salt intoxication. And a lot of times what people have actually gotten into, it may not be a problem. You may be causing more problems with your home remedy than the thing itself. So always call us first. There's never a case where we would ever recommend inducing vomiting or taking any substance to try and start vomiting.
Awesome. Yeah, I think that's definitely one that I have heard a lot of people think, and by just logic, it kind of makes sense. If I swallow something poisonous, I want to get it out. But it's good to know that, that's not, that's not what you should do. And, poison control can tell you what the right steps are. Okay, now let's talk about our final myth for today, which is that poison control can only help with at-home poisonings, so poisonings that take place at home. Robert, can you tell us why that's a myth and what other settings we can help with poisonings in?
Sure. I mean, the easiest one is we get calls from workplaces all the time. So whether, if you're working we hear from restaurants, people cleaning up. We hear from lab technicians, lab workers, chemical spills, even hospitals themselves where they're not calling for a patient, they're calling because say a nurse or physician got a disinfectant in the eye or a needle stick or something along those lines. So workplace hazards, even when firefighters call, they may be on scene, say a house fire or a gas leak or something like that. Those kind of environmental hazards we hear about that. When people are outside because the weather's about to change, it's about to be spring and summer and awesome weather. So that means it's plant season, mushroom season, bite season, stings. So that's coming up. So people are hiking on the great outdoors, taking the walk, enjoying nature, and all those situations can occur. So it certainly doesn't have to be in the home. It doesn't have to be in the hospital. It doesn't have to be in the lab. It doesn't have to be in the restaurant, the workplace, you name it. We're standing by to handle it.
Awesome. So helpful. Thank you. So these are all of the myths that we had prepared to talk about today, but I want to allow anyone who's watching, if you have any questions, to write them in the comments section, and we will be able to see those come in and we can answer those if you have any. So we'll give a couple of minutes for that. And in the meantime, I would love to know if for Robert and Elizabeth, if either of you have a favorite tip for preventing poisonings that you would like to share with us.
One of mine is always call first. I mean, sometimes we'll get people who've taken double doses of medication, and I can't tell you how many times they'll say, I couldn't remember if I took it, so I took it again. So one of my things is that in between step, call us. Some medications, it's not going to matter. There's a couple that it really does matter. So I think that extra step of picking up the phone and just calling and saying, should I skip it? Should I take it? Is a really preventative thing to do, I think.
Love that. Yeah.
Agreed. I mean, I just had calls recently, a lady who was worried about her blood pressure medication, wasn't sure if she's supposed to take it again or not. And so, yeah, I'd much rather hear before people take the medication so we can weigh in and help them out. Absolutely. So I think my prevention tip is something I talked about just seconds ago, is the container transfer situation. Please keep everything in its original containers. Also, because if you have to call, it's going to make our job helping you more difficult and can complicate things if you don't know what that blue liquid in the bottle was. Is it antifreeze? Is it mouthwash? What percentage is it? What medication? Look, I'm guilty of it myself. When you're traveling, it's easy to throw a handful of ibuprofen and a handful of allergy medication or sleep aids or whatever it is in the travel bottle and head out. But what happens when you get home and the travel bottle full of different medications gets put back in the shelf or left out, and the kid gets into it? Is it heartburn medication? Is it blood pressure medication? So please keep it in the original container.
Yeah, those are great tips. Thank you so much. I don't see any comments or questions coming in, but as we go, I just want to remind anyone watching, the poison control phone number to get help 24/7 is 1-800-222-1222. And again, we are available 24/7. Our nurses and pharmacists and physicians are ready to answer your questions, whether it's an emergency or not. And I want to thank Elizabeth and Robert and Emily for being here with us today. And I hope that this has been fun for you guys. It's been really fun for me.
Oh, yeah.
A lot of fun.
Yeah. And I hope that everyone watching has learned a lot and feels more comfortable now if you ever need to call poison control in the future. All right. Well, thank you so much. And have a great afternoon.
Call
Bye.
Poison Center first. Call Poison Center first.
Call first.